Now we are going to see the effects of psychotropic drugs. These drugs work by altering the balance of the neurotransmitters like serotonin, dopamine, uh, aminobutyric acid, GABA, or these chemical messengers. They carry signals among your organs to regulate their functions in the brain. They help the neurons to communicate with each other in order to control concentration, perceptions, mood, and other aspects of brain functions. They are specific to the cells that they are targeted. Here we are going to see some of the types of antidepressants. So basically, there are five major types of antidepressants like SSRIs, SNRIs, TCAs, and NAOIs, and atypical antidepressants. These antidepressants have side effects which vary by medication, and not all people experience them in the same way. Okay, the most common are anxiety, blurred vision, these are the side effects, constipation, dizziness, dry mouth, fatigue, numbness, insomnia, nausea, sexual issues, and weight gain. More serious side effects include suicidal ideation, allergic reactions, mania, seizures, hyponatremia, and serotonin syndrome. So every psychotropic drugs, when they are consumed, they not only benefit the body, but along with that, shows the it also leaves, I won't say shows, but leaves the negative traces of that component also. Here we are going to see the side effects of antipsychotics. So antipsychotics is basically used to prevent psychosis. The side effects of atypical antipsychotics can include weight gain, metabolic problems, sexual issues. Those of typical antipsychotics tend to be more severe and can include tremors, spasms, muscle rigidity, and loss of control and coordination, any of which can become permanent even after treatment, and after the treatment is stopped. So, side effects of antipsychotics are also something which we need to be equally aware of. Anxiolytics are addictive in nature. Some such components include, or medicines include benzodiazepines. They work by increasing the GABA levels in your brain in order to keep you calm and help you sleep. Non-benzodiazepines, such as Indium, are chemically different, but they also help in boosting the GABA receptors. Beta blockers are usually prescribed for heart problems and are sometimes given to help with phobias and fear of certain situations. They help us to control sweating, shaking, and an elevated heart rate. Barbiturates as well as phenobarbital are similar to but much stronger than benzodiazepines and have been used to treat seizures in children. They are also prescribed in order to help with insomnia. Hypnotics are a class which includes drugs that induces and lengthen sleep. When used this way, they include barbiturates, quinazolin, zolinones, benzodiazepines, non-benzodiazepines, melatonin, antihistamines, and antidepressants. So these are some of the side effects which you need to also be aware of. Stimulants increase the brain activity to raise mood and alertness. They include common substances like caffeine, nicotine, as well as illicit drugs like cocaine and methamphetamines. Prescription stimulants, sometimes they start affecting the central nervous system and the autonomic nervous system. They enhance the effects of dopamines and norepinephrine. They can increase the blood pressure, respiratory function, and euphoria. In the past, they were prescribed as a good compound for aiding weight loss, but their addictive nature has stopped that use. Today, they are most often used to treat attention deficit hyperactivity disorders and narcolepsy. Like all drugs, psychotropics come with a range of side effects, and some of these include cardiac issues, changes in appetite, dizziness, nausea, vomiting, drowsiness, fatigue, sexual side effects, sleep disturbances, weight gain. Although psychotropic drugs helps us in regulating emotions and mood, they can also adversely impact the emotions. For example, there might be a hard time for an individual or for a client who's under a treatment in crying when he actually or she actually feels sad or is experiencing a pain. So this is how the side effects we can feel and we can sense it. If psychotropics make you feel not like the way you want to be, then at that situation you need to alert the doctors and the caretakers around you so that they can immediately provide you with alternative treatments and medication. So, a sense of responsibility from the client side, from the individual side, is also equally important when it comes to the part of curing. It's a two-way process, it's not a one-way process. So that also needs to be kept into our notice. Before taking psychotropic drugs, as a client, be sure to share with the healthcare provider any known medical issues of your past or present, such as heart conditions, diabetes, or high blood pressure, in order to ensure that the medication will not increase or aggravate the already existing health conditions. Also, at the same time, I would like to give a word to the clinicians while administering the psychotropic drugs. Please ensure that you are also equally aware of the pre-existing conditions of your client. You can identify that while taking the case history or while discussing about the individual in an informal conversation, so that it also becomes easier for you to also administer the correct form of psychotropic drug along with the therapy which you plan to give for your client for his or her betterment. Last but not the least, I would like to end the topic on a note which says that you live only once. You are responsible for your life, for your own decisions. You don't live forever. So, whatever you have, make the best use of it. Do not waste it and make wise decisions. Thank you so much. Catch up with you with my more slides. Thank you all.